Okay. Hi, everyone. Welcome. My name is Dana Howarth. I'm the Deputy Director for the New Mexico Caregivers Coalition. Glad to see everyone here on a Friday afternoon. So thank you for joining us. I think I recognize a lot of names, but I also see some new names. So just a quick introduction to the New Mexico Caregivers Coalition. We're a small nonprofit in New Mexico who provides service, resources and trainings to caregivers, both paid professional caregivers and family caregivers. We not only train caregivers in New Mexico, we also reach many of you folks who are joining us from parts of Arizona. Thanks to one of our partners, Valerie Sosi. You want to say hi real quick?
Hi, everybody. I'm glad that you guys made it. It's Friday, it's cold, so I hope you guys are staying warm and enjoy a wonderful presentation by Samantha. So we're all vaxxed with the sheep and the puppies, and we can be covered.
Thanks, Valerie. So before we get started, just a quick reminder, if everyone while we're during the session, if you can keep yourselves on mute, it helps limit background noise for the recording. During today's presentation, Samantha Morales, our guest speaker from the Senior Medicare Patrol, will do her entire presentation, and then she'll do a Q&A at the end of her session. So if you have any questions, drop them in the chat or write them down, and during the Q&A, she'll open up the floor to ask for questions. If they're in the chat, either me or Valerie will read them out loud for you. So if that's something you're more comfortable with, you're welcome to do that as well. Also, during her presentation, she usually has sometimes asked questions and stuff. So if you want to interact, feel free to use the chat for that as well. If you haven't already, make sure you say hi in the chat if you have access to the chat. Valerie and I will be taking attendance, so it helps us know who's here to make sure you get credit for being here. And you will get a certificate for this class at the end of the month. They'll be sent out to you. Trying to think, make sure. Oh, and also don't worry about trying to jot down all the information Samantha's about to share with you. I will be sending out the slides after class, including any other links and stuff that she likes to share in her presentations. I'll include that in the email also because it's easier for you to access that way. So without further ado, I'm going to introduce our guest speaker, Samantha Morales. She's the director of the Senior Medicare Patrol. Samantha?
Thank you so much, Dana, and hello, everyone. Hello, Valerie. Thank you again, New Mexico Caregivers Coalition, for having me, for giving me this space to be here with all of you. And of course, on your Friday, thank you for taking the time to be here and to participate in this, what I think is an important training on Medicare coverage of vaccines, because there's so many vaccines, right? And there's so many different parts of Medicare, all the alphabet soup. So I'm going to try and just as we go through the training, break it down as best as I can and simplify it. And with that, I think, Dana, you have my slides, correct? Wonderful. Fabulous, thank you. Wonderful, so if we can move on to the next slide, the agenda. And in today's training, so we will review each of these bullet points. So the Part B covered vaccine, there's a few of them. The majority of Medicare covered vaccines are covered under Part D, so we'll kind of delve into that complexity a bit, tease it out. And then of course, Medicare's coverage of the COVID-19 vaccine, I'll provide more specific information about that. And there's a case study that I would like to go through with everyone and walk you all through that. If we can go on to the next slide, please. Thank you. And these coming slides, the next two slides are going to be pretty much review for many of you who have been with us before where I've presented. So this is just kind of some more information about the Senior Medicare Patrol program. We are a state program, which means we're completely free and accessible to all New Mexicans across the state. And we're federally funded to do the work. And part of the work that we do, the mission is here. We work to empower and assist Medicare beneficiaries, their families, caregivers, all of you, to prevent, detect, and report healthcare fraud, errors, and abuse. So anything against the Medicare program that's fraud related, that's billing related, we're there to help the public. And we do this through community outreach, of course, these types of Zoom sessions with partners like the New Mexico Caregivers Coalition, spreading the word, and of course, direct counseling with families, with Medicare beneficiaries, with their seniors, and education. Thank you, Dana, for the next slide. You're ahead of me, but in a good way. So in this slide, just a brief overview. Many of you most likely already know many of the facts on this slide, just to kind of go over some of the most important pieces of the Medicare program as we know it. So it is the federal health insurance program, and it was created in '65. It was signed by Lyndon B. Johnson, and it was meant to cover some of our most vulnerable populations of people. So we're talking seniors, people over the age of 65, people living with disabilities who were unable to get any type of commercial health insurance before this law was created. People were literally dying without being able to access healthcare because they couldn't afford it. So this law is very, very important. And so it continues to be important because now it covers people, as you all may know, people who age into Medicare who are over the age of 65, or people who have a status with Social Security Administration due to their disability who are eligible because of their disability status. So that includes folks with end-stage renal disease, for example. It also includes folks who have other types of very high needs, like people who are diagnosed with Lou Gehrig's disease or ALS, for example. So Medicare continues to be a very important health insurance program to cover these folks. Unfortunately, the Medicare program, I should preface this by saying, starting with a positive, Medicare is a very comprehensive health insurance program. It provides hospitalization and outpatient care, as you'll see in the next slide, but it wasn't designed to cover all of the costs. There's some cost sharing that people have to pay when they're in Medicare. Usually, Medicare covers 80% on an approved claim. The remaining 20% is going to be the responsibility of the person. If they have secondary insurance, which many people do, then that's fabulous. The secondary health insurance like Medicaid, for example, can function to cover the 20%. Some people also have retiree insurance, union insurance because of their work, they have that supplemental coverage. Lastly, the last bullet point is just to remind everyone how robust the Medicare program is. It continues to be a strong program. People continue to be enrolled in the program. It's over 61 million people. So it's the most important public health insurance program that we have in the United States. And now with that, if we can go on to the next slide. This slide is also going to be very brief because I realize this could be review for many of you. So this is just kind of delving into the different parts of Medicare before we can even begin a discussion on vaccine coverage and which parts of Medicare cover the vaccine. It's important to just look at what the map looks like. What does Medicare cover? And it's composed of different parts. So the hospital insurance is represented by Part A. Part B is medical insurance, which is outpatient care. So if you think about it, outpatient care is just as important as hospitalization because it's going to cover all of those claims when people have to go to the doctor, when they have to go to the emergency room, when they have to get durable medical equipment like a walker or a wheelchair. All of that is going to be covered by Part B. And now original Medicare, the traditional Medicare federal program, the way it was envisioned, it covers Part A and Part B. So when we speak of Medicare Advantage plans, Part C, that's just another way of saying, again, private health insurance plans, Medicare Advantage, that contract with the federal government to provide people with an alternative way that they can receive their Medicare benefit. So it's not an extra benefit. When people receive their red, white, and blue Medicare card, they don't get Part A, B, and C on it. They just get Part A and B. But if they want, they can choose to receive their benefits through a private health insurance plan that's known as a Medicare Advantage plan to receive Part A, Part B, all in one card. Now, the last part, Part D, is outpatient prescription drugs. So it's essentially that. It's when people get a prescription from their doctor. Maybe they have an antibiotic that they have to take, and they have to go take that prescription to a pharmacy. It's going to be the Part D plan, if the person has one, that's going to cover that prescription. Or maybe the person has to take maintenance medications like blood pressure medication, et cetera. That is going to be covered by a Part D prescription drug plan through Medicare. So if people need drug coverage, they really need to take action steps to find the right Part D plan that will work for them. And with that, let's go on to the next slide, please. And so in this first part of the training, we're going to delve into the coverage of vaccines under Part B. So we start with Part B first. Let's go on to the next slide, Dana. Thank you. So it's important to note that in general, I'm just going to preface this. So the takeaway point, so in general, Medicare Part D covers most vaccines and immunizations. However, there are a few exceptions to that, where Part B covers the vaccines that are listed on this slide. So these are the ones that are covered by Part B as in boy, right? So we have the ones that we all have heard of, right? It's the influenza or flu vaccine. And this includes the seasonal vaccine and, of course, the H1N1, also known as swine flu vaccine. The pneumonia shots are also going to be covered under B. Hepatitis B shots are going to be covered under Part B as in boy. And lastly, COVID-19 vaccines, including the booster, all of those are going to be covered under Part B as in boy. And with that, let's move on to the next slide, please. So we're going to start with kind of delving a little bit more into each vaccine. So here we have more information on the flu vaccine. So there's two takeaway points that I would like all of you to take away with this slide, right? The first one, Medicare covers flu shots, number one, right? Even before we start delving into all of these details. The second takeaway point that is important to highlight, when people go to receive the flu shot, so where they go to receive the flu shot matters, and it can affect the cost of when they receive the flu shot. So that is what is really important to highlight too. So if Part B covers the flu shot, so every flu season, that includes the high dose flu vaccine. So if we walk through the slides, that bullet point where it says the flu season usually runs from November through April. And depending on when the beneficiary receives the flu shot, Medicare can even cover a flu shot twice in the calendar year. So I have an example to illustrate that. So for example, if you get a shot in January of 2022 for this year during the flu season, you could get another shot in November of 2022 for the next flu season. So that's one thing to keep in mind. So for this flu season, so people, if they start in January, they can boost up with another flu shot in the fall. So that's important to keep in mind. So during the same, because the flu season, again, it runs from November through April. So people have an opportunity to receive the flu shot. So the bottom points of the slide that are important have to do with what kinds of doctors are in the Medicare program and where people can go to receive the flu shot. So original Medicare, as a reminder, as we list in this slide, covers flu shots at 100% of the Medicare approved amount. What does that mean, right? When the person is eligible to receive the service, meaning the doctor, they meet the criteria to receive it, they have their support of their doctor, and they go to what is known as a participating provider. Their doctor participates in the Medicare program. So we're talking about the person who uses their red, white, and blue card, who uses original Medicare. So when they go see a participating provider and in the provider's office, they get the flu shot, Medicare is going to cover that at 100%. So it's important to ask the doctor, well, what kind of doctor are you? Because we want to make sure to save the person the most money that the doctor is a participating provider. So I'm going to delve into in the next subsequent slides later in the presentation, about all the different types of categories of providers. But this is just an important takeaway point. People save the most money if they receive the flu shot at a participating provider. Now, if the person has a Medicare Advantage plan, what's important to keep in mind is they really should communicate with the plan to find out where they can go get the flu shot for the best deal, right? So that they don't pay anything. Because if they go and get the flu shot at an in-network provider, then the Medicare Advantage plan needs to cover that flu shot completely without applying deductibles, co-pays, or co-insurances. But again, it has to be an in-network provider. If people go outside of the network, then the plan can impose other costs. So again, it matters where people go to receive the flu shot. It's important for them to ask those questions. So the other thing that I wanted to mention very briefly is just there's many people that we hear about that go to receive the flu shot at their local pharmacies, like, you know, the big chain pharmacies, Walgreens, CVS, et cetera. So it's important. Many of those pharmacies may be able to bill Part B as in boy because flu vaccines are covered under B, but some of them may not. So if Medicare beneficiaries, if a senior is going to get their flu shot at a pharmacy, it's important for them to ask the pharmacist, can you bill Part B for my flu shot? Because not all pharmacies have that ability to send those claims to Part B. Some of them do, many of them do, especially the big ones, but it's important to ask the question. And with that, we're going to go on to the next slide. Thank you. And here we have more information about the Part B coverage of the pneumonia vaccine. So a lot of information here. And as many of you know, pneumonia is an infection that targets the lungs and it can cause fever, difficulty breathing, severe symptoms, for some people, even death. So pneumonia shots help to prevent pneumonia, this very serious illness. It could develop into a serious illness for some people. So in terms of Medicare Part B coverage of pneumonia, the Medicare Part B covers two different pneumonia shots, right? So under the first bullet point, we see the first shot is covered under Part B if the person has never received a pneumonia shot under Part B before, right? And then the Medicare Part B covers the second, a different pneumonia shot 1 year after the person receives the first one. And then the last bullet point under that first section there is that people really don't have to bring documentation to their doctor's offices when they receive the second pneumonia shot. They just have to let the doctor know, I received my pneumonia shot on this date. And then the doctor will, the doctor's office or their staff will be able to provide guidance in terms of when the next pneumonia shot is due, if it's due in that visit. Now, the bottom part of the slide is also, again, this reminder of where people go matters. If they stick with participating providers or in-network providers, that's the best way to save the most money when it comes to Part B covered vaccines. Because for people who use the red, white, and blue card and they're in original Medicare, Medicare will cover the shots at 100% of the Medicare approved amount if the person is eligible and if they go see a participating provider. People get into trouble if they go to other types of doctors who are not categorized as participating providers. Now, for people in private plans like Medicare Advantage plans, again, the plans are mandated to cover this at 100% when people follow the rules. If they don't and they go outside of the plan's network, they go see a doctor that's not in the plan, for example, that's where the plan can start charging people. So it's important for people who have private Medicare Advantage plans to call the plan first, ask the plan representative where they can go or if their doctor is an in-network provider, just to confirm where they can go get their pneumonia shots to save the most money. And with that, let's move on to hepatitis B vaccines. Perfect, thank you. So just to begin, hepatitis B, as many of you know, is a virus that attacks the liver and can cause chronic liver disease. Hepatitis B shots, again, can help prevent the disease. So they're very important. So an important takeaway point in this slide is that a person's level of risk for hepatitis B matters in terms of Part B coverage, right? So if the person has a low risk for hepatitis B, then Part D, as opposed to Part B, will cover it. So that's an important takeaway. So what level of risk is the person? If they're at a medium or high level of risk for hepatitis B, then Part B is going to cover that vaccine. And the same rules apply about going to a participating provider to receive the vaccine in the doctor's office or communicating with the Medicare Advantage plan. And in this slide, I just provided some examples of what Medicare considers medium or high risk. So you can kind of see some of, some of those examples here. The person can have end-stage renal disease, hemophilia, they're a client or a staff member at an institution for the developmentally disabled, for example, they live in the same household as a hepatitis B carrier, etc. So any one of these would Medicare, any one of these examples, if the person is in one of these situations, Medicare would consider them medium to high risk, and that's where Medicare Part B would cover the hepatitis B vaccine under B. And with that, if we can go on to COVID-19 vaccines. So as many of you know, the Food and Drug Administration, the FDA, has approved an additional dose of the COVID-19 vaccine or the booster for certain at-risk, well, at this point, it's not even, it's for everyone, especially for at-risk populations, including people over the age of 65. So the additional dose is covered by Medicare with zero cost sharing. So I'm going to say that again. Medicare is supposed to cover the COVID-19 vaccines at 100%, where the person who's on Medicare owes $0. So that's one major takeaway. In addition, it's important to keep in mind that as we review this slide, original Medicare Part B will cover the costs of the COVID-19 vaccines, regardless of whether the person has and uses the red, white, and blue card, the original Medicare card, or if the person is enrolled in a private Medicare Advantage plan. So regardless of what kind of Medicare coverage the person has, original Medicare Part B will be covering the COVID-19 vaccines. So those are pretty much the takeaway points. So again, it's covered at 100%. The only last point that I'm going to emphasize before we move on is that if the person does not have their original Medicare card, then they can expect when they go to receive their COVID-19 vaccine, any one of those vaccines, right, whether it's the booster or whatever, the doctor can ask them for their social security number. Only if it's, again, the provider's office asking, is it safe to give out that information? Because the doctor needs to look up the person's original Medicare information, and they can do so with the social security number. And this is only the case when the person cannot present their original Medicare card with their Medicare number. So with that, let's move on to Part D coverage of vaccines. Perfect. So in this section, we're going to kind of delve into the Part D coverage of vaccines and immunization. So as I mentioned before, Part D covers the majority of vaccines. So let's move on to the next slide. Thank you. Okay, so here we have more information on kind of the Part D coverage, like what Part D covered vaccines are out there. So the main takeaway point in this slide is that Part D plans cover the majority of commercially available vaccines, except for the few that are listed here on this slide that we've already covered under Part B. So most people will be dealing with their Part D plans when it comes to coverage of the vaccines that they may receive, for example, in their doctor's offices. And this is where it can get tricky. And we will be exploring this in kind of this later slides in this training when we discuss billing issues with vaccines. But this is just important to note. So it's going to be Part D as in David. That's going to be pretty much the part of Medicare when it comes to vaccine coverage that most people will be dealing with, except, if they're getting the flu vaccine, the pneumonia vaccine, hepatitis B or COVID-19 vaccine, since those are covered by Part B. And with that, Dana, if we can move on to the next slide. So here, I would like to walk through this slide and provide more layers. So the main takeaway point is that point, the first bullet point there, the cost depends on where people receive the vaccine. So it's kind of like a theme in this training, right? Where people go matters. So here, beneficiaries should check with their Part D plans to figure out the rules that the plan has and where they can go to receive a specific vaccine that's covered under Part D for the best price, right? And again, people as listed here, to get the best deal with vaccines that are covered under Part D, they should go to an in-network pharmacy, or they should ask their doctor if the doctor can coordinate with a pharmacy to bill Part D, right, for the whole vaccination process, the administration and the injection, or if the doctor's office can bill directly, right? If they can have a way to electronically send the claim to the Part D plan. That is really, really important. Really, really important, because if the doctor can't bill directly, there could be problems for the Medicare beneficiary. So we delve into that in the last part of the slide. You can see that people are going to pay more, essentially. That's the takeaway. They're going to pay more if the doctor, if their provider, their doctor's office cannot coordinate with the pharmacy to bill the Part D plan for the entire vaccination process, or the doctor's office they cannot bill the plan directly for the vaccination through an electronic billing system. So it's better to ask proactively if they're going to get the Part D covered vaccine in the doctor's office. So one example of a vaccine that we're going to kind of see is the shingles vaccine. A lot of people are, their doctors recommend that they get the shingles vaccine. It's important. It's very, and many doctors can administer it in their doctor's office. However, the shingles vaccine is covered under Part D as in David. So before the doctor does that, administers the shot, the Medicare beneficiary really should be asking, or the caregiver should be asking the question, wait, can you bill my Part D plan for this shingles vaccine? I need to know because I don't want to pay more money. And if they can't, then they really should ask the plan. The Medicare beneficiary may want to contact the plan first to find out where they can get it. And so a few other things before we move on, Dana, to the next slide that I wanted to mention. So if the person follows the plan, the Part D plan's rules, and they go to an in-network pharmacy and they go to a doctor's office that can bill the plan, the Part D plan directly, the person should only need to pay the plan's approved coinsurance or copay for the vaccine. When a person receives the vaccine in their doctor's office, as I mentioned, they should really be asking the doctor if they can bill the Part D plan for that. And then with that, without complicating the slide even more, that I've given so much information, I'm going to move on to the next section, which is vaccine billing issues. Thank you. So here we're going to delve into, again, the complex billing issues that can happen with Medicare covered vaccines, especially when they're covered under Part D as in David, which the majority are. So if we can move on to the next slide. Perfect. So again, in this slide, we delve into the complexities when people have when people receive a Part D covered vaccine in their doctor's office. So what can people expect, right? So if they're in their doctor's office to receive a vaccine that's covered under Part D, but then maybe the doctor is providing other services, for example, the person is being treated for something else, then again, as listed on the slide, the person can expect to receive a bill for the diagnostic care that they receive during a preventive visit. So the doctor can charge for the other services that were provided, even if it's covered under Part D. So there could be other charges when people go to receive a Part D covered vaccine in their doctor's office. That should be expected, right? And then below, I wanted to list some reasons why some doctors may be unwilling or unable to bill Medicare for vaccines and their administration, right? So the first one, the provider may just ask the Medicare beneficiary upfront to pay in full for the services. So the person goes in to get, for example, my example of the shingles vaccine, and the doctor says, well, I'm gonna have to charge you for the shingles vaccine. And so the person has to pay upfront for that, even though it should be covered under Part D. But the question is, can the doctor even bill Part D, right? Then the second bullet point, the provider has a status that is known as opt-out. They've opted out of Medicare. So I'll delve into what that means, but that's one reason that can be given if a doctor cannot even bill Medicare for a vaccine, right, that they administer. The third bullet point, the provider believes Medicare will deny coverage. In this situation, maybe a doctor thinks, I don't really think you meet the criteria for that specific vaccine. I think it's important for you to get it, and I support, I really think you should have this vaccine, but according to Medicare's rules and guidance, you don't meet the criteria for coverage. So I'm going to have to charge you for the vaccine, even though I think it's medically necessary for you to get it as your doctor. So in that situation, people can definitely do something about that. They can request the doctor to bill Medicare first, even if they think that Medicare will deny. So that's something that they can do. Is they can even say, before you charge me though, I need you to bill Medicare because I want to make sure that Medicare processes the claim, right? And this is assuming that, again, the provider can, whether it's a Part D covered vaccine, if it's a Part B covered vaccine, they should be able to bill Part B. The last bullet point that I wanted to mention is when a doctor refuses to bill Medicare and does not give a reason, like they don't even say, they just say, I don't even want to mess with Medicare, I'm just going to bill you. Now that could be illegal because it really depends on what kind of status the doctor has. And so it's important to, if you hear of a situation like that, where a senior or a Medicare beneficiary is being asked up front to pay and the doctor doesn't give a reason why, then that could be fraudulent. And I mean, Medicare beneficiaries are protected by Medicare. They have health insurance coverage through Medicare. So providers that are in the Medicare program have to abide by Medicare rules. They're protected. So it's important for people to know that they can tell their doctors and push back, wait a minute, I have Medicare, you can't do that. Why are you charging me up front? What is the problem? If the doctor says, well, I'm an opt-out provider, then there are other things that the opt-out provider needs to do, which I'm going to get into more in the next slide. But I just wanted to kind of mention, doctors need to give a reason why they're unable to bill. And so if there's no reason and they just say, oh, well, I can do this, well, they actually can't, and they could be reported. And there's hefty fines for doctors who do that. And so with that, let's move on to the next slide. And of course, I should mention a plugin for our SMP program, because that's why we exist, is to help people who encounter those kinds of billing problems. It's called balance billing, when a doctor just charges the Medicare beneficiary upfront for a service without sending the claim to Medicare. So we can definitely help in that situation. So please get in contact with us so that we can walk the Medicare beneficiary, or you, if you're caring for someone in Medicare, we can walk you through the process of how to resolve the issue with the doctor's office. So here in this slide, we kind of delve a little bit more in the discussion. So can providers refuse to bill for vaccines? I wanted to continue that because it's important to tease out what the Medicare status is of different providers in the Medicare world, right? As I listed here, provider status matters. So each of these checkpoints, check marks, is really, I define each of the there's 3 different providers in the Medicare world, starting with participating providers. These are providers that accept Medicare. They always accept Medicare's payment as payment in full. That's called the assignment. They take assignment. So taking assignment, again, as I defined it here, means that the provider accepts Medicare's approved amount for the healthcare service, right? Participating providers are really, there's strict rules about what they can do. So Medicare dictates participating providers are required. They don't have a choice. They have to submit an electronic claim and send it to Medicare, and they can't charge people up front. So that right there, if there's a participating provider that's charging people up front, that's a violation of their terms with Medicare, and they can be reported. So it's important to ask a new doctor when a senior goes to see a new doctor and they're making for example, scheduling a visit in the new year, like now, they should really be asking the doctor's office, what are you a participating provider or plans network? So, but sticking with original Medicare, the other check mark here, the non-participating provider is also important here to define. So these are providers, they accept Medicare as a health insurance, but they don't accept assignment. And what that means is that they don't accept Medicare's payment for the services in full. What does that mean? That means that a non-participating provider can charge a Medicare beneficiary above the Medicare approved amount. And nationwide, that limit is 15%. They can charge people 15% above the Medicare approved amount if people go see non-participating providers. So again, the message is Medicare beneficiaries can save the most money if they make sure that the doctor that they're going to visit is a participating provider, right? So that's important to keep in mind. The other thing about non-participating providers, which is interesting, is that they are allowed to charge Medicare beneficiaries upfront for services. They can say, I'm going to need to charge you for the services. However, they have to send the claims for the services they render electronically to Medicare. Medicare will process those claims. They will reimburse non-participating providers, and then those providers have to reimburse Medicare beneficiaries once they're paid. So that's important to keep in mind. It's somewhat of a complicated situation there when people see non-participating providers. Now, the last category is problematic, right? These are doctors that people really want to stay away. They're opt-out providers. These doctors have registered with Medicare to be opt-out. Opt-out means that they do not accept Medicare as a health insurance. And they also have to inform Medicare beneficiaries about their opt-out status in writing with a contract before they render any services, so that the Medicare beneficiary can understand that if they receive services from an opt-out provider, that doctor will charge them in full and they are responsible for the full cost of the services they receive. So I guess at the end of the day, when we take it back to the conversation about vaccines, you can see with these different categories of providers, seniors really should be going to participating providers so that they can save the most money, right? They really should not be going to opt-out providers, and really non-participating providers can be complicated because they can charge people up front and they can charge them even 15% above the Medicare approved amount. So it's always better for people to see participating providers. And with that, I'm going to go on to the next slide, please. Thank you. So here we'll delve into a case study to kind of apply some of these concepts that we've been discussing. So if you can go on to the next slide, please. Thank you. Okay, so this case study, what I'm going to do is I'm going to take the approach of reading the narrative first, pose the question, and then we'll go into the next slide, reading each of the responses that are available. So the first, let me just read the narrative here. So Miss O'Keefe, she scheduled an appointment to get a flu shot at her provider's office. So she has a new Medicare Advantage plan. She's in a private plan this year, and she made sure that her doctor is in network, right? She was adamant about that. So during the visit, Miss O'Keefe discussed her arthritis, her sugar levels, and the doctor ordered lab work before the nurse came in to administer the flu shot. So a month later, Miss O'Keefe was surprised when she received a bill from her doctor's office charging her the full amount for the flu shot. So she thought flu shots were covered by Medicare, and she's definitely confused. She's not sure how to address the billing issue. So the question we pose is, what next steps should she take to address the billing issue? And with that, we're going to go on to the next slide. Thank you. So I'm going to read each response, and then I'm going to request that for anyone who feels so inclined and would like to participate, I would welcome you to choose the best option, and then we can reconvene. So I'll give you a minute, but I'm going to read each option first. So option A, letter A, Miss O'Keefe should just pay the bill and look for a new doctor, right? Option B, Miss O'Keefe should call the police and she should report the doctor as this is completely illegal. Option C, Miss O'Keefe should call the doctor's office and request that they bill her her Part D portion of her Medicare Advantage plan for the flu shot. Option letter D, Miss O'Keefe should call the SMP to receive assistance with this billing issue. Option letter E, both C and D apply. So I'm going to just give everyone a minute to just kind of review the options on your own. And then if you would like to share your responses in the chat, feel free. And then we can reconvene in about a minute. Thank you. Thank you for the music.
I was literally singing that in my head.
I wish I had a cash prize, everyone. Right? That would make it, maybe I can get funding for that. Well, wonderful. Our minute is up. So again, thank you so much for the music. Makes it much more entertaining. So let's go through this as a group. Now, I want to confess something actually that I discovered, and I wonder if others have found out my mistake. And so I'm going to start with that because I'm going to use this as a learning opportunity. My mistake on this slide and with this case study, because I think just looking at the chat, thank you everyone for being so wonderful with sharing your answers. And I think option letter E is the most popular option, and it would have been the correct response. However, my mistake in that was my idea when I created this case study is to have option letter E be the correct response, because we would want, what is option letter E, right? Option C, Miss O'Keefe should call the doctor's office, which is always a good idea, and request that they bill her Part D portion of her Medicare Advantage plan for the flu shot. And then of course, option letter D is the SMP program is a resource that you can always go to, right? We offer free services, we can provide help. However, guess what? The flu shot is not covered by Part D, as in David. It is covered by Part B, as in boy. It is one of the few vaccines that are covered by B. I just caught that myself. I should have used the correct example that I should have used that would have been more, would have illustrated C and D, would have been the shingles vaccine. The shingles vaccine is covered under D as in David. So it gets complicated when people get the shingles vaccine in their doctor's office, because that's what I wanted to show is how complicated it is. If the doctor charged her up front, most doctors, they know how to bill B. They can bill Part B, especially if they're participating providers. The problem is not everyone can bill Part D as in David. They can't bill, not all doctors can bill the Part D portion of a plan, right? The prescription drug plan. That's where I wanted to get into it, but I made a mistake. So in this case, it's not you, it is me. It should have been option letter E, but in this case, that would be incorrect because we wouldn't want to tell her, tell your doctor to bill Part D, because no, that would have been wrong. Her doctor, there may be some other kind of billing problem. He shouldn't have billed her. That's wrong. So she needs to figure out what else is going on. But it was my mistake with even using flu shot as an example. It should have been shingles or some other kind of Part D as in David covered vaccine. But excellent, everyone. Thank you for participating and hearing me out. And at least we could discuss, that distinction. Flu shots are covered under B as in boy. So even with her Medicare Advantage plan, because her Medicare Advantage plan has Part A, B, and probably she has a D as in David under 1. So the doctor can certainly bill the Part B as in boy portion of her plan. So what's going on with her doctor, right? Why is he billing her? So that's the main takeaway when this for Ms. O'Keefe. But with that, I'm going to request that Dana move on to the last section of our training. And so in this last section, I'm going to just provide you all with information that we're getting at the S&P program from our national partners. At the S&P network is national, as you may know. We have other S&P programs, each state. So for those of you in Arizona who are with me today, there is an S&P program in the state of Arizona that receives federal dollars to provide this advocacy assistance, right? So we're connected in a network. And so we've been getting reports from scams that are affecting our seniors that are focused and related to COVID-19, either vaccines or services. So let's go to the first scam. Dana, the next slide. Thank you. So we've been hearing about, strangers who are calling seniors who are saying that they want to help them schedule a vaccine. So they're calling them over the phone. Typically it's over the phone that we've been hearing, and they identify themselves as being from the Department of Health or from some other official agency, right? From Medicare, and they want to help them schedule them. So in the process of getting information, these scammers, they're being friendly. They're, these social engineering techniques that we hear about. So they're giving their publicly accessible information like their address, date of birth, and then they're asking people for their Medicare numbers. And that's where people can fall into that type of scam, because with the Medicare number, Medicare beneficiaries can compromise their Medicare because these scammers can bill for services that were never received. So this is something that if you can spread the word in your communities, it's very important, because we're definitely hearing about an uptick with these types of scams that are targeting our seniors. And then the next slide, another one that's very unfortunate is testing scams, which you probably have read about in your local papers, right? Because I know in Santa Fe, in New Mexico, we had a few of these testing scams happen recently. So scammers, for example, they create unauthorized COVID-19 testing centers. And the site staff at these unauthorized testing centers, of course, they start requesting personal information. This could be the Medicare number, Social Security number. I mean, the one in Santa Fe was literally just shut down. So this is happening. Like there was, press about this. There was a line out the door for people who were trusting these sites, and they're unauthorized. They are not authorized by the Department of Health or the state of New Mexico or any other entity. So this is just something to keep our eyes on. We don't want our seniors to have to go into these centers that just pop up and they're not even authorized, right? So it's important to spread the word. The other thing is also scammers who are selling unauthorized at-home lab kits to detect COVID-19. So we hear about the shortage of, the at-home tests. Of course, there's a new scam, right? Making the rounds in different states of these people, telemarketers calling seniors, targeting them, trying to sell them these unauthorized testing kits. And they usually are asking for personal information. It could be over the phone. It could be on an email, unsolicited email. And they're asking for medical information. They're asking for financial information or their Medicare and Social Security number. So it's a lot of damage that can affect Medicare beneficiaries. The next slide, please. This one, unfortunately, is not new, but it's something that continues. We keep getting reports that this is making the rounds. And this it has to do with a vaccine survey that people are getting via their emails. So it's about COVID-19 vaccine survey. It could have a fake Pfizer logo on it. But basically, it's a survey that tries to move people using a link, an undisclosed link online, where they start asking for personal information. They also try to hook people with, oh, we'll give you a prize if you complete the survey, but they're trying to get information from the Medicare beneficiary. So be on the lookout for those strange scams. Also, if you see or hear something about this in your community, please report it to us. Report it to the SMP program so we can report it. We can report. So the next slide, please. And then this one, it has to do with providers, offices, doctors who really are unethical. And they're adding additional add-on services when they see a Medicare beneficiary in their offices, or when they're giving telehealth medicine, when they're providing telehealth services. Maybe they're meeting a Medicare beneficiary about something else, and then they start adding all of these other COVID-19 related services that the Medicare beneficiary really doesn't need. It could be requesting, like as I mentioned here, it could be requesting, for example, that the Medicare beneficiary receive additional COVID-19 tests that they don't really need. And then maybe the add-on services can include things like um, genetic testing, home healthcare services, durable medical equipment. So just, for people who are seeing their doctors, it's important that they receive the explanation of benefits or the Medicare summary notice later to review what services the doctor charged for. Because if they see something that it's just not correct, like, wait a minute, I went in for a flu shot, or a flu shot, and then they're charging me for all of these other COVID-19 related services that really are not medically necessary. That's where people can report it. They don't have to just let Medicare pay for it. Because maybe the doctor, maybe they have a secondary health insurance, maybe they have Medicaid, or they have some other health insurance that's going to cover the remaining costs, but it would still be fraudulent. So people can still report it. They don't have to just take what the doctor charged, right? They can definitely question it and contest it if needed. Thank you, Dana. The next slide. Perfect. So this is just a reminder of what we do. Just again, a plug-in for our services, because we're free and we provide objective information. We provide support when it comes to connecting with federal agencies like Medicare, CMS, the Office of Inspector General. So we can definitely help people report when there's a problem, and we can also help people figure out why there's a billing problem with the doctor's office. So if you find yourself needing a little bit more guidance with a Medicare billing issue, I welcome you to call our offices, because that's what we're there to do. That's what we get paid to do. So let's go on to the next slide. And these are just resources for all of you. These are my go-to resources on these topics, because as Dana said in the beginning, and I should have reiterated that, none of us, even those of us who are advocates for a long time, I know I don't memorize any, some of these issues can be complex, and that's okay, because guess what? We have the resources accessible. So I can point you to good resources, and 3 of my favorite resources are on this slide, which I'm hoping Dana or Valerie can send around later in an email so that you have the links. This is to Medicare Interactive, which is a really great site that provides consumer-friendly information. They also train many of us, the SMPs and the SHIP programs, so they are a federal contractor. They provide reputable information. Medicare.gov is also good, but sometimes I feel like they don't always use consumer-friendly information. But Medicare Interactive is made for consumers. So just, and this gives you some of the important articles that they have on these issues. And let's move on to the last couple of slides, my plugin for SMP volunteers, SHIP and SMP volunteers. I always add this slide because we couldn't do the work without having our volunteers. So we train our volunteers on Medicare issues, and we provide support, and we work with their hours, right? So some of them work, some of them are retirees, but we work with anyone who's interested in learning about Medicare and who wants to give back. So if you are one of those people and you would like to learn more about our program, please let me know or get in contact with Valerie or with Dana. And so we'll connect that way. And then the next slide, please. And this is how you can reach us. You can contact us through the 1-800 number. We have an email at the state where you can reach us. And you can also contact us via web chat. However, guess what? Because you're here, you're part of the New Mexico Caregivers Coalition, you also can contact me directly, and that would be through Valerie or Dana. So if there's a case that you're working on, if you're a caregiver and you are caring for someone who's on Medicare dealing with a Medicare complicated issue and you just want guidance, please reach out, because I'm more than willing to call you if you give me that permission, and follow up with you directly, and we can figure, I can connect you if it's not within my area. I can connect you to another colleague who can assist. So please reach out. And then the last slide has to do with our survey. So if you have 3 or 5 minutes of your time at the end of this presentation, I welcome you to take our SurveyMonkey survey. That it is a legitimate survey. I'm not asking for personal information. It's anonymous. So it's just about the presentation today. And it's asking you to give your feedback, because this is how we can improve our services. So I welcome any and all your feedback. And then the last thing is questions. So I think at this point, we can kind of open it up for questions. I realize it's 4:31, but I'm more than happy to take a few minutes and just review some questions. So Dana or Valerie, if you'd like to help, I'm scrolling through the questions, but if there's any that stand out to you from the beginning.
Just for folks, since we did run over a little time, we understand if you need to leave, feel free to do so. Thank you for joining us. We appreciate it. Just to say out loud, I will be emailing everyone the slides and the links that Samantha showed in the slides. So you'll have them in the email that will go out after we end today's session. However, if you have questions, feel free to stay and Samantha will answer your questions. But we want to make sure everyone who does have to leave knows that it's okay to leave, because we are going over time. So thank you all. But let me scroll through the chat to see for those that did ask questions.
Definitely, and it looks like there was one about pneumonia vaccine. Is this different for kids versus adults? And the answer, first disclosure, I'm not a medical provider. So I would say chances are, yes, it's going to be different for kids versus adults. So the pneumonia vaccine, what I was talking about in that slide is really about people on Medicare. So typically, adults, people, although there are some children who are on Medicare. But in this case, it's really for the majority, it's adults. But I would say the pneumonia vaccine, again, that's going to be a conversation with the primary care physician for that person. They should start with the doctor, and then the doctor can provide guidance about, yeah, you really need to get your pneumonia vaccine. This is the time to get it, or, next year is going to be better. So there should be a difference. I'm sure a medical provider could address that question in a more scientific way, but I'm going to say in terms of the information I provided, it's about adults, people on Medicare. And then scrolling through, let's see if there's another.
Well, on that topic, since
yeah.
I was on pneumonia, there's a second question on pneumonia vaccines. It
Okay.
says you mentioned that Medicare Part B covers 2 different pneumonia vaccines. Since the vaccines are different, does it matter which one the person receives first?
That's another question for the doctor's office. That's another good one. But the key takeaway in our discussion, though, is they're 2 different vaccines. So the person should not be receiving 2 of the same vaccine on 1 year, the same vaccine, and then the next year they give them the same vaccine. So the doctor should be able to tell the person which one they can receive first. And then the person, when they go back to their doctor's office, they can say, have a conversation again, but it should be covered the next year, the following year after they receive the first vaccine. Then there should be a second different vaccine. So, but that is going to be a conversation that the person should have with their doctor in terms of which which type of those pneumonia vaccines the person should be getting first. Hopefully that's not a cop-out, but yeah.
I mean, that does make sense though, because if the doctor's giving them the same one, then they could be doing something fraudulent by giving the person the same vaccine twice.
Exactly. And it may not protect the person, right? If it's the same vaccine, maybe they're going to need the second different vaccine. They're entitled to a different pneumonia vaccine is the point in terms of Medicare coverage.
I think this question's trying to ask why they make the process so difficult.
So Amanda, your question, so do they make it so difficult for people to go through the process? I know, I agree. And I think what you're getting at is the discussion around Part D covered vaccines. And when a senior goes to the doctor's office and they get something like the shingles vaccine, why does it have to be so hard? I agree. And I think what we can do in terms of caregivers and as advocates is we can just remind our seniors, just ask the simple question, what kind of doctor are you? Are you a participating provider? That's what I'm interested in. Or are you, if I have a Medicare Advantage plan, are you in my plan's network? Because I need to know, I want to save the most money. And then the second question, if it's a Part D covered vaccine, like the shingles vaccine, and the person knows that they need to get it and the doctor's recommending it, the question for the doctor is, hey, can you bill my Part D plan, my prescription drug plan for this? Because I don't want you to charge me up front for this. I know how this is going to play out. So, I mean, they don't have to be like that, but you know what I mean? They can ask, can you bill my prescription drug plan? Because I know if you can't, that's going to be more trouble and more money for me. Because my plan, chances are, is not going to reimburse me everything I'm going to pay you for what you're going to charge. So I need to know if you can electronically send that claim to my prescription drug plan if it is a shingles vaccine or any other vaccine that's covered under Part D as in David, and I'm in the doctor's office. Because if the doctor says, oh, I have no idea how to bill your prescription drug plan, then I would say, I'm going to have to call you. I'm going to have to come back then. I'm going to call my plan first because I'm not going to pay you $300 and then I get reimbursed $27. That's really what it looks like. People pay out of pocket an exorbitant amount of money they get charged. And then at the end of the day, they get reimbursed by the prescription drug plan for like a fraction of what they paid. And then the Medicare beneficiary thinks, what happened? So it's important to let people know these are just a few questions you can ask. You don't have to know everything about Medicare, because I agree with Amanda, it's so complicated, the process, but we can just arm our seniors with those questions. And then let's see if there's other questions that I'm not seeing. There's a question from Brian, it looks like. You mentioned that Medicare Part B covers two different, oh, and I think that's the one you mentioned, Dana. So we addressed that one. Let's see. Yep, it looks like, I don't know, I'm not seeing any other questions. Is there something that I left out or I didn't catch? Or any other questions that folks have?
You answered mine with your slide, the fraud scam number.
Oh, awesome. Wonderful. Well, I know this could be complicated, but I always want to, at the end, I always say, don't worry, you don't have to memorize everything, because just knowing that hopefully the SMP program is a free resource, I can point you to other resources and assist with any Medicare billing issue that you may have.
All right, well, thank you so much, Samantha, for another great guest presentation. I feel like these are really helpful. And just a reminder, I will send an email out with the slides and all the links for everyone. And thank you all for those that stayed a little bit late. We appreciate it. Thanks again for joining us, and we hope to see you at the next training soon. So hope everyone has a great weekend.
Have a great
Bye,
weekend.
everyone. Thank you.
Bye.
Stay warm.
Thank you.
Guys.
Stay warm. Bye.